wellness revolution starts now.
Hello, I'm Dr. Steve Hotze, and welcome to today's program. I have my guest on our program is our senior new guest consultant, Sherry Good. And Sherry has been with our center now for at least 20 years, if not longer. How long, Sherry? Has it been 20 years?
I came in as a patient 23 years ago. Been with you, started working there in 2004.
So she's been a guest for at least 24 years and started working as a new guest consultant 20 years ago in 2004 and has helped literally tens of thousands of individuals on board and get in to be evaluated so we could get them on a path of health and wellness naturally. Now, let me just tell you, Sherry knows more than 99.9% of the doctors about natural approaches to health because she spent her life counseling people and helping people understand what they need to do and what we do here at the Hotze Health and Wellness Center. So she's broadly read in the subject of natural approaches to health, particularly natural hormones, female hormones, male hormones, thyroid, vitamins and minerals, healthy eating program, allergies. And when a new guest comes in who has been visited with by Sherry, I know that they understand what we're going to do because Sherry's very thorough. So for all of you that are interested in getting on a path of health and wellness, all you have to do is call our new guest consultant line, 281-698-8698, and you will likely be placed with Sherry. You can ask for Sherry, and we've got other really outstanding new guest consultants. Jennifer's wonderful as well. But I thought we'd get Sherry on today because she's been with me the longest, and she hears the questions people have about what's going on in natural approaches to health, what their concerns are. So, Sherry, why don't you just share with us what you're hearing from current guests, both women and men. And by the way, ladies and gentlemen, about 75% of the people that come into our center are females. And obviously the balance are males. Now, why would it be such a disproportionate number of females? Well, females are much more attuned to their health, and it has to do with the fact that they have monthly menstrual cycles. So they're very attuned to the way they feel over a month as they cycle. And when things begin to change, they oftentimes come in and see the doctor and want to know what might be going on. Men, on the other hand, don't have the cyclical changes in their hormones. We just have a steady decline in our hormones. So men aren't quite as attuned or near as attuned to their health issues as women are. Besides, men tend to be much more hard-headed. And what we find is that men will oftentimes encourage their wives to come in. They've heard my program on a podcast, or they used to listen to me on the radio, or they watched me on Brighty on TV, and they go, honey, you need to go in and see Dr. Hotze. Well, sure enough, the wives will come in, and within a few years, next thing I know, there comes the old boy. They come dragging him in, saying, no, you got to fix him up. And he goes, I can't keep up with her. So we see that very commonly. Isn't that right, Sherry?
Absolutely. All the time.
By the way, I just want to let you know I saw a lovely lady in the office on Monday that has been talking to you. Of course, I'm not going to mention her name, but she's been talking to you for about 20 years. And she came and she's called you over the 20 years, listened to my program, and had really taken good care of her health because she followed all the things that I recommended. Finally, she had a roadblock and she said, okay, it's time for me to come in. And you said, yep, it's about time. And you know who I'm talking about. So I'm so glad, it's, ladies and gentlemen, it's interesting. Sometimes somebody will hear about us. Maybe they hear a radio ad, or they see, or somebody give them a copy of one of my books, or they listen to me on the radio for years. And some people, it takes years for them to come in, and some people, it takes a short time. They talk to a friend says, go to the Hotze Health and Wellness Center, get yourself well. I did, and it helped me. So it's always interesting to hear the pathway people take to come to the center. But they always have to go through a new guest consultant. And Sherry Good is our most experienced and senior new guest consultant. And we really appreciate all you've done, Sherry, to help us communicate our values, our culture, our treatment program to our guests. Thank you.
You're welcome. It's truly a privilege.
Well, so what do you hear from, what are the questions you get from individuals when they call? Particularly, we want to talk about women and female hormones, although we're going to talk about male hormones towards the end of this broadcast.
Women really have a kind of the top 5 are low energy. Hair loss is big on the list. Hair loss, joint pain, brain fog. They just can't think, focus, concentrate, remember as sharply as they used to. And they know they're smart. They know they're intelligent, and they feel like they're losing some of that. They really start to have trouble with sleep. A lot of women confess no libido or very low libido, and they don't understand why. No one really explains that to them. But one of the things those are very common symptoms that I think almost all women go through. And I highly recommend all women come to our clinic at some point and don't wait, because we're all going to need some adjustments as we go from decade to decade. But one of the things that I've noticed lately is that quite a few women and their husbands being on the phone with them saying, I'm now in menopause. I've listened to you for years, and now I'm in menopause. I never thought this applied to me, but now I feel it. Hot flash, night sweat, vaginal dryness, cannot sleep, irritable, just their essence. They feel their essence is gone. But their doctor, their otherwise very well-intentioned doctor, is telling them, don't get on hormones, they cause cancer. That's the statement. And that is not a true statement. So I wanted you to explain so people could understand the health protective benefits of natural bioidentical hormones.
Well, of course, let's do that by starting off to explain female hormones and how the hormonal system works in a woman's body. When a woman enters puberty, her ovaries begin to make the female hormones, estrogen hormones, and there are 3 main estrogen hormones a woman makes: estriol, estradiol, and estrone. She also makes another female hormone, primary female hormone, called progesterone. So when she starts her cycles, first day, once she goes through her period, she then starts to make estrogen hormones. The estrogen hormones are all produced by the ovaries. They stimulate growth. They proliferate growth of the inner lining of the womb. Mid-cycle, day 14, day 15, the ovaries will ovulate. And that means they give off an egg, which travels down the fallopian tubes into the receptacle, which is the uterus, waiting to be inseminated in order to conceive. And right where that ovary is made and is ejected out of the ovary, there's that part of the the ovary is called the corpus luteum. It begins to make a hormone called progesterone. Progesterone promotes gestation. That's where we get the word progesterone. So it matures the inner lining of the womb that's been proliferated by all the estrogen. It matures it, waiting for the egg to be implanted and inseminated. So the newborn baby or the new conceptus, the new developing baby, can thrive in that environment. And if indeed a pregnancy develops, well, then the ovaries continue to make progesterone to promote the gestation. Eventually, as the baby grows, he develops or she develops their own placenta, and that placenta then makes all the hormones of pregnancy, primarily progesterone. That placenta belongs to the baby, not to the mother. And that placenta is making all the hormones. Then when the baby's delivered, the placenta is also delivered, and there's a precipitous drop in hormones. Now, prior to delivery, usually a month prior to delivery, the placenta just manufactures large amounts, multiple times what the body would ever make normally of progesterone. And women often have a burst of energy. I know my wife did in all 8 of her pregnancies, but the week or 2 weeks or 3 weeks before the pregnancy, she just felt so good. She was energetic and wanted to get a lot of things done. It doesn't happen with every woman, but I've had women tell me who've come in for hormonal problems, if you can make me feel like I did during that last month of pregnancy, I'll do whatever it takes. Whatever that was in my body, that's what I want. Well, it was progesterone. So let's back up now. So in a regular menstrual cycle, every month a woman cycles. She has her period normally in a perfect world, a 28-day, 30-day cycle. So she'll make estrogen all month long, proliferating the inner lining of the womb. She will ovulate, make progesterone, which balances the estrogen. And then if there's no pregnancy, the ovaries quit making the hormones, slough the inner lining of the womb. And that may last initially 3 to 5 days and be mild to moderate. As a woman marches through her menstrual life, particularly after she has children, the ovaries have been shut off for 9 months. And now she has to start making her hormones again. Oftentimes, those ovaries don't really kick in as well as they did. And women go like, I feel great until I had my first baby or second baby or third baby. And after that, everything just went south. My energy went down. I gained weight. I can't think clearly. I've got brain fog. I've had women in their early 40s go to doctors that treat dementia and have been told they have Alzheimer's disease, literally, because they can't think clearly. They can't remember. They got brain fog. And so premenstrually, what happens in these women as they march through their menstrual life, they make estrogen hormones, but the ovaries get older and they don't make as much progesterone. So instead of being balanced out, the estrogen tends to become the dominant hormone. And in some months, as women march through their menstrual life, they get into their late 30s, early 40s, they will have anovulatory cycles. That means they don't ovulate at all. And if they don't ovulate, they don't make any progesterone. That means that month, all they had was estrogen flowing through their body. And that estrogen proliferates the inner lining of the womb. It never matures. And then when they have a period, it's very heavy. It might be 5 to 7 days. Then it's 7 to 9 days. Then you got clotting. And then women get intermenstrual bleeding. And so they get a host of problems. They get fibroid tumors. And they get premenstrually, they get mood swings, fluid retention, headaches, breast tenderness, migraines. They just feel terrible, the loss of romantic moods and inclinations. And they go to their OB-GYN, and of course, when they tell them the problems, the OB-GYN sees dollar signs in front of his eyes because an OB-GYN doctor he's a surgeon. He delivers babies the first half of his career. He does hysterectomies the second half of the career. That's the way they operate. I had an OB-GYN tell me when I was in training, he said he prospects in his office every day for hysterectomies. Now, that's ridiculous. Most hysterectomies are completely unnecessary. The reason a woman has abnormal bleeding and heavy bleeding and dysfunctional bleeding, dysmenorrhea, which means painful periods, and intermenstrual bleeding and fibroids is because low levels of progesterone. And she has high levels of estrogen. And so what we do is we balance those out with the natural hormone progesterone. So as soon as a woman, ladies, as soon as you begin to have premenstrual symptoms, the mood swings, the fluid retention, the weight gain, the heavy periods, fibroids, breast tenderness, migraines, that happens premenstrually. Maybe it starts 1 or 2 days before your period. Then it's 3 to 5 days. Maybe then it's a week. And some women say, I have it for 2 weeks before my period. And what we do is recommend that a woman take natural progesterone. That's the hormone that the body would make normally, but it's not making it in adequate amounts or at all. And we use progesterone day 15 through 28, then stop it, and then woman has her period and we start over again. And that will take care of a host of problems and will prevent a woman, if she starts early enough, prevent her from getting that dysfunctional uterine bleeding and the fibroids and all the things that lead to a doctor saying, I can cure you. chance to cut, chance to cure. We'll just take that uterus out, do a hysterectomy on you, you won't bleed anymore, which is true. Take a hysterectomy, you do a hysterectomy, you're not going to have any more bleeding. But it's not the womb that's the problem. It's not the uterus. It's the hormones. The hormones aren't balanced. So you've got to replenish the hormones using natural bioidentical. What does that mean? Hormones that are identical biologically to the hormones your body made. These are not counterfeit hormones. You would find counterfeit hormones oftentimes when women have this problem. If it's depending on where they are in their menstrual life, the OB-GYN will say, well, just take birth control pills. Well, birth control pills turn off all your natural hormones. And these are synthetic, and they are not biologically identical hormones. They contain a progestin, not progesterone, but they contain a progestin, which shuts off the production of your natural progesterone, which can be very, it serves to function to help balance out your estrogen hormones. Because when estrogen gets out of balance, women that have low levels of progesterone, it's been shown in studies. There was a Johns Hopkins study in 1981 that showed that women that were infertile due to low levels of progesterone had an almost 600% increase in breast cancer and 1,000% increase in death of all types of cancer just because of low progesterone. So progesterone balances the estrogen. Estrogen is a proliferative hormone, and unbalanced, it can cause problems in the breast. You know, you get breast tenderness. If any of you ladies have had estrogen dominance, you know what I'm talking about. Maybe you get fibrocystic breast disease, and you go to, and we don't recommend going for mammograms. We know that it's been shown that mammograms increase the risk of developing breast cancer because they crush the breast, they cause damage to the breast, and the radiation also causes damage. And we don't recommend that to do that. And you know, my wife, who's now 74, I don't know when she had a last mammogram, 30 years ago, maybe. We just, as we read about it and studied about it, and studies were coming out, that wasn't what we wanted to recommend to our guests. We knew that we could help prevent and protect against breast cancer by simply balancing estrogen by giving progesterone. Now, when a woman marches up and goes through the change of life, and that would be menopause, happens on an average at 50 years of age. The pre or perimenopausal symptoms can start at 45, 46, 48. They may go through the change that early. They may go through menopause. It may not go through the complete change until they're 52 or 54, but averages on a bell-shaped curve, 50 years of age is about the time a woman quits making her natural hormones in the ovaries. Her ovaries shut off. She makes no more estrogen. She makes no more progesterone. And progesterone is so very important. And not only is it important during a woman's menstrual life to balance out the estrogen and strengthen mature the inner lining of the womb, but it's very important for brain function. It affects the neurotransmitters in the brains. It has a calming effect. It helps relieve migraine headaches that are due to estrogen dominance. It can be a godsend for women that have premenstrual migraines. It can be wonderful. It helps with sleep. It helps with bone strengthening, as does estrogen, but progesterone stimulates new bone formation. So this is very important so you don't develop osteopenia or osteoporosis as you age. So once women go into the change of life, they begin to have additional symptoms like the night sweats, hot flashes, and severe mood swings. They may have depression. It varies from woman to woman. Some women are tougher than nails, and they kind of suck it up. But for most women, it's a significant problem. I just talked to a lady yesterday, and she said, my mother never told me what it was going to be like. And she had just come in and she said, I had no idea it was going to be like this. I don't know why she didn't tell me, but I'm here because I need help. I'm having hot flashes. I'm having mood swings. I feel depressed. I'm gaining weight. I can't think clearly. I got joint and muscle aches and pains. I got sluggish bowels. I just feel like my get up and go has got up and gone. I just sick and tired of feeling this way, which we hear this very commonly. people telling me, I'm sick and tired of being sick and tired. They've been to their physicians, and oftentimes their physicians, conventional doctors, will say, don't take any hormones. No, that's dangerous. It can cause cancer. Or if they do give them hormones, they give them counterfeit hormones. One of the counterfeit hormones that are given while a woman's still menstruating are the birth control pills, which cause an increased risk of breast cancer and a host of other diseases, blood clots, heart attacks, strokes. All these things are increased with the use of birth control pills. These are not natural hormones. And so you're putting something unnatural made by drug companies to we call them counterfeit hormones. They counterfeit what your natural hormones do, so they don't have the protective effect, but they have all the adverse effects. So if you're going to take hormones, replacement hormones, and replenish your hormones, you want to do it with the same identical hormones that your body made when you were younger. Now, the aging process is really simple. It's the inevitable imbalance and decline and loss of your natural occurring hormones. When your female hormones go down and you get the imbalance between estrogen and progesterone, that adversely affects your thyroid hormones. You produce thyroid binding globulin, which bind up your thyroid hormone. And your thyroid hormone, of course, comes from your thyroid gland in your neck. And the thyroid gland in the neck produces thyroid hormones, two types, T4, which has 4 iodine atoms. Here's a thyroid hormone, or T3, which has 3 iodine atoms. Well, T4 is made 94% of the time by the gland. It's the inactive hormone. It circulates in the blood. It doesn't do anything. The thyroid hormone doesn't do its actions in the blood. It has to get into the cells. And inside your cells, if you're healthy and you haven't been flooding your body with a bunch of petrochemical products and fluoride, which I highly recommend you eliminate, you get some kind of filter on your sink so you're not taking fluoride, and get it out of your toothpaste, and don't let a dentist swab you with it, because it adversely affects your ability to convert your inactive thyroid hormone T4 to active thyroid hormone T3. That's the active thyroid hormone. And the thyroid hormone goes into the cell to the power plants in the cell, and the power plants in the cell are called the mitochondria. And the mitochondria have to have a spark plug, and the spark plug's the thyroid hormone. And the thyroid hormone stimulates energy production within those cells, so those cells produce energy. And what happens as you get older, you have estrogen dominance, and your estrogen goes away. Inevitably, your thyroid gland produces less thyroid hormones. And if you have an imbalance if you're taking some kind of counterfeit hormone, estrogen alone without any progesterone, you build up thyroid binding globulin, which would bind thyroid hormone. They can't get into the cell adequately, and the cells can't produce energy. In the cells, they act as that spark plug that causes the mitochondria, the power plants of the cell, to produce electrical energy. So most individuals that hit 50, 55, 60 are low voltage. You know what I'm talking about. You feel that way, right? Low voltage. All your get up and go is got up and gone, and you don't know what to do. You've been to the doctor. Maybe they've tried you on Adderall, or they're trying to give you a stimulant, which is an amphetamine. Maybe they give you Concerta, another type of amphetamine. Maybe they're giving you antidepressants, which can totally ruin your life. I highly recommend staying away from any SSRI antidepressant. Increase the risk of suicide by 4 to 6 times if you take it. That's a Prozac-like drug. They put you on anti-anxiety medication, sleep medication, anti-inflammatory medication. You're on a host of medication, and the more medication you take, you get sicker quicker. And the reason is that nobody is sick because of low levels of pharmaceutical drugs. The way to stay healthy is get your hormone levels back, get them back up, and replenish them. So you rejuvenate your body. You feel youthful again. And so we recommend natural thyroid hormone when you have symptoms of low thyroid. We will not base our treatment on your blood tests alone, although we look for thyroid antibodies to see if you have autoimmune thyroiditis, which is a real definite indication to take thyroid hormone. But if you've got the clinical symptoms of low thyroid, we're going to give you incrementally small doses of thyroid, trying to fill up the tank, so to speak. So you've got enough thyroid to operate at an optimal level. We're also going to balance out your female hormones with not only, many doctors just give Premarin. Premarin is what? It's estrogen from horses. It's horse estrogen, pregnant mare urine. That's what Premarin stands for, pregnant mare urine. And many OB-GYNs just give Premarin to a woman, so she's got estrogen dominance. They feel terrible. I've seen so many, literally thousands of women over my career that have come in and they've been on Premarin and they feel like the dickens. They just feel horrible. They're bloated. They can't think clearly. They're tired. They ache. No romantic moods and inclinations. Sluggish. Can't think clearly. Joint and muscle ache. They just feel terrible. That's because they've got estrogen dominance, which is adversely affecting their ability to utilize thyroid hormones within the cells. So their metabolism is low. They're low voltage. They got no energy, got no get up and go. And we take them off the Premarin, we put them on natural bias, which is estradiol and estriol, the two of the natural female hormones that are estrogen hormones that a woman makes, plus progesterone. Put you on those preparations, and it is a godsend. I literally, the whole Hotze Health and Wellness Center was really initially started as a allergy practice back in 1989. By 1992, I had been encouraged to look into thyroid in my women by a fellow allergist friend of mine, and I started doing that. We began to treat with natural desiccated thyroid rather than Synthroid or Levoxyl or Levothyroid. We used natural thyroid, which we compound here now at our pharmacy. Natural ingredients. It's the hormones that these are derived from pork gland, and these particular hormones contain the same identical thyroid hormones that your body makes, T4 and T3. It's got a little more T3 than your body makes, so it helps kickstart, really get those mitochondria and the power plants up and running, and that can be very helpful. And then we balance out the female hormones using estrogen, natural estrogen. This is in menopausal women, and progesterone. And this can be an absolutely lifesaver for women and a godsend. And, I wrote a book about this, which I'd be glad to send to you. If you just give us a call at our phone number this is Hormones, Health, and Happiness. So I've got a whole chapter about thyroid. I've got a whole chapter about female hormones, treatment of yeast, natural supplements, vitamins and minerals, treatment of allergies, both airborne and food allergies. And I took a chapter out of that book and I expanded it, the book called Hypothyroidism, Health and Happiness. And so this helps explain our philosophy on thyroid hormones. I really should send this out to every doctor in the city or in the state. Every one of them should have bought this book. This is what we've been doing here at the Hotze Health and Wellness Center since we opened in 1989, but this is what we've been doing since 1992, is treating thyroid. And then in 96, we started to treat with female hormones. And let me just mention that this whole concept that, if you take hormones, you're going to get cancer. I'm going to tell you what, your risk of cancer increases if you took birth control pills, and it increases if you don't take any hormones, particularly progesterone. Women with low progesterone levels had a almost 600% increase of breast cancer. These are women that were low progesterone, that were in childbearing age, but they were infertile because they didn't make enough progesterone. And they had almost 600% increase in breast cancer and 1,000% increase of death from all kinds of cancers. So progesterone has an effect on cancer cells. It's called apoptosis. It causes cancer cells to die. So it's very, very important. And frankly, we use it in men as well, progesterone, because it's thought and appears to be one of the reasons men develop prostate cancer when they get older is not because of testosterone. It's because they have converted in their body, they begin to make estrogen. And the estrogen hormone affects the prostate gland like it does women's breasts. And it can stimulate the growth of cancer. So we give progesterone to balance out any estrogen that men may be making to cause prostate cancer. So that covers the heart of females. We want to talk about males. Did I cover everything that I might need to?
Yes, that was so very thorough. That was so good. That really, really covers a lot of it.
So, and there have been, significant studies. The Women's Health Initiative study that was held back started in 1993. It was reported in 2002, showed that there was an increased risk of cancer for those on hormone replacement therapy. But the hormone replacement therapy they were using was horse estrogen, Premarin, mixed with Primpro, progestin, medroxyprogesterone, which cuts off the production of natural progesterone. So they're getting a counterfeit horse estrogen, and they're getting a counterfeit drug-made progestin, which increases the risk of cancer, where natural progesterone decreases the risk of cancer. So and that's when everybody got all upset. Oh, my goodness, what are we going to do? Well, then a lot of doctors took their women off the Primpro and put them on Premarin or just put them on basically SSRI antidepressants. They were using that to treat menopause, as if the reason women are going through the change of life is because they have low levels of antidepressants in their body, and this chemical drug from the drug companies is going to solve the problem. It's ridiculous. We addressed that this came out in 2002, and we addressed it back then, and we have treated literally tens of thousands of women with natural bioidentical hormones with just wonderful success. Now, our program involves not only hormone replenishment therapy, it starts with good, healthy eating, and that's a yeast-free eating program, which I talk about in my book, Hormones, Health, and Happiness. We talk about the yeast-free eating program. We also treat people when they have airborne and food allergies. People that have airborne allergies get recurrent and chronic sinus infections and get bronchitis and asthma and those sort of things, and get skin disorders. Foods can set off the same reactions that the airborne allergies can. Then we treat for natural thyroid replacement when it's indicated, and we use natural female hormones when women begin to have their premenstrual symptoms as they march through their menstrual life, and then they go into menopause. We use natural bioidentical estradiol and estriol, and we use natural bioidentical progesterone. You might say, where did these come from? Well, they're derived from plants, yams in particular, and it's a hormone in the plant called dioxygenin that then goes to a lab, and it is chemically converted into the same identical progesterone or estrogen hormone that your body made. It's bioidentical. It can't be patented by the drug companies. That's why drug companies come up with counterfeit hormones that are biochemically not identical to your own hormones, because then they can patent them for 17 years and sell them at outrageous prices. But they come with a host of health problems. So we believe that the best thing to do is, if you're going to replenish hormones, which we highly recommend that you do to stay youthful, rejuvenate yourself, feel bright, young, and alert again, take those hormones and you'll feel that way, and it will help prolong your life, not just to be alive, but a healthy life. If you're going to be alive, there's no reason in the world you shouldn't be brimming with energy, full of vitality, and enthusiastic about life. So if you want to learn about all this, I encourage you to call 281-698-8698. It's on our screen, and ask them to send you a copy of the book, Hormones, Health, and Happiness, and you can read about the hormones in there, read about our yeast-free eating program, read about our treatment of airborne and food allergies, and also about our vitamins and minerals. This will help you understand that there's an alternative pathway to health. I do not believe that the pathway to health is using toxic pharmaceutical drugs. I do not believe in the drug companies. I don't believe they have our interests at heart. They have one major interest at heart, and that is basically to keep people sick and keep them on their drugs all their life, rather than preventing them from having health problems, naturally, they want to wait till they have the problems and they want to give all their pharmaceutical drugs, which, by the way, are all toxins. And toxins are poisons, and they all have to be detoxified by the liver. So that's why, say, for instance, you're taking anti-cholesterol medication. The doctor said, we got to check your liver enzymes. Why? Well, because it destroys the liver. It can cause liver disease. So that's why we're such strong advocates of natural approaches to health. I hope this helps. By the way, let's just mention on testosterone, the idea that testosterone, some people say, well, you don't take testosterone when you get older. Doctors tell them, you don't need a testosterone. Your testosterone level's fine. They'll tell an old guy 50 or 60 or 70 or 80, oh, your testosterone's in the normal level. Well, here, gentlemen, or wives for your husband, testosterone levels when a man's in his 20s and 30s, the levels that are given on the blood work when they come back from the lab are here, 20 to 30. And then they make them lower, 30 to 40. They lower the levels so you can be in a normal range and lower than you were in your 20s. Then it's 40 to 50, 50 to 60, 60 to 70, 70 to 80. By the time you get down here and in your 50, when you're 50, your testosterone level is about a third what it was when you were in your 20s. By the time you're 60, it's a quarter what it was. By the time you're 70, it's down. It's in the basement. Now, why does that matter? Because testosterone affects a man's initiative, his assertiveness, his self-confidence, his moods, his goal orientation, his drive, his directiveness, his analytical ability, his muscle tone, his muscle mass, cardiovascular function, romantic moods and inclinations. It gives him his male pattern behavior. That's what young boys have. When they're in their 20s, they join the Army and they run up a hill right in the face of a machine gun because they think they're invincible. That's the hormones. That's the testosterone talking. Now, young men, when they go to work, they don't know anything, but they're trying everything. They got all the drive. And then as men get older and they've developed all these business skills or professional skills, if they happen to be in a professional field, once they develop that, then they get into their mid-50s, their testosterone goes down in the gutter. They don't have the drive. They got all the experience, but they don't have the drive to go forward. And they get depressed and, sit around on Saturday in their underwear, drinking beer and watching football games. You know what I'm talking about? And we want these guys to be up and at 'em, right? So we recommend testosterone injections. I personally started on it when I was 46. I'm 73 now. I'm going and blowing all the time. And I credit the testosterone with having them, and I take the thyroid too, and I credit with that keeping my energy level up. Our whole program is built around helping you generate energy within your cells. If you have high energy production, you're going to be a high voltage individual. You're going to be a live wire. You're going to have a great time. You're going to enjoy your work. You're going to enjoy your family, enjoy your wife, enjoy your friends, enjoy your sports. It's going to be great. But if you let all this go down, men, your testosterone go down, you're going to drag around. I've seen it. I see it when I play golf. I see it in the locker room. These old guys come in. They're younger than me. They're all kind of bent over. They're pale and pasty. They're washed out. Why is that? Testosterone stimulates red blood cell production. So a person that looks ruddy, he looks healthy. But these old guys, they all gray and they just slumped over. And I can look at them and say, those guys need testosterone so bad. A little testosterone would put a tiger back in their tank. And that's what it does. That's the truth, too. You know that, Sherry.
That is true.
Okay, we covered quite a bit here. Is there anything else we need to discuss?
Those are the main questions that I have been getting lately that I really appreciate you explaining it so well. Those are the main ones.
Well, that's great. And I thank you for the wonderful care you take of our guests. By the way, folks, we don't call people that come into our office patients. We don't have any patients. We only have guests. In 1996, we decided we were going to get out of medical practice and go into the hospitality industry. Now you go like, what? Yeah, we're going into the hospitality industry. And within that context, we're going to provide medical care. So we literally benchmark with the Ritz-Carlton and their their hospitality model and with the Broadmoor up in Colorado Springs, and we have their people come in and train our leaders, and our leaders train our people, and we send our people off to conferences, and we have them come into our conferences. So it's been a great relationship. But our goal is for every one of our guests to be instilled with hope and make sure that we fulfill their unexpressed need and wishes, so they have confidence going forward and they know that we care about them, we understand them, we affirm them, and we are going to help them get on that path of health and wellness naturally. We're the coaches, the health coaches, so to speak. Mm-hmm. And our guests, we call our patients guests, and they are the ones that are the health athletes. We're the health coaches, and we give them recommendations. We make recommendations. No, we don't put a gun to anybody's head. Most people follow the recommendation because they pay their own money. They take charge of your health. By the way, we don't take insurance here. This is a cash-based practice. The reason I did that is I never worked for the insurance companies ever. Never was any part of HMO, PPO. The reason is because they wanted to control what type of medicine I practice. And I said, no, we're not going to do that. We're going to provide natural approaches to health. And because they're in cahoots with the pharmaceutical companies, and they're all one big medical industry, and we're not going to be part of that. We're going to work for our guests and help them get on a path of health and wellness naturally. And that's what we're committed to do. So if you want to be part of our Health and Wellness Center, guest here, be part of the family, we'd love to have you. And we'd love to be able to give you copies of the books so you can read that and decide for yourself. But we're here and available. And when you call, you may be fortunate enough to get Sherry or Jennifer. Either one of them will give you wonderful answers to your questions and help you get scheduled to come up and be evaluated so you can get on a path of health and wellness naturally and have a more enjoyable, fruitful life full of energy and vitality and enthusiasm. So thanks for joining us today. I'm Dr. Hotze. Look forward to seeing you when you come in. God bless you.
At Physicians Preference Pharmacy, we understand that the quality of your compounded medications directly affects the way you feel, which is why we believe that your pharmacy should specialize in compounding medications while also delivering extraordinary hospitality and guest service. We believe that both patients and prescribers should accept nothing less than consistency and quality from their compounding pharmacy. This is why we've implemented some of the strictest quality standards in compounding, exceeding standard requirements, achieving PCAB accreditation, which is the Pharmacy Compounding Accreditation Board, an organization that sets the highest standards in compounding pharmacy regarding the safety, cleanliness, and quality of your compounded prescriptions. Because of our commitment to complete health and wellness, we are dedicated to making your medications free of lactose, parabens, artificial sweeteners, and any unnecessary dyes, binders, or fillers present in many other medications, offering you the cleanest products possible.
Information provided on this program is neither intended nor implied to be a substitute for professional medical advice and is not intended to replace the services of a physician, nor does it constitute a doctor-patient relationship. You should not use information from this radio program to diagnose or treat a health problem or disease without consulting with a qualified healthcare provider. If you have or suspect you have an urgent medical problem, promptly contact a professional healthcare provider or call 911. Dr. Hotze's Wellness Revolution advises you to always seek the advice of a physician or other qualified health provider prior to starting any new treatment or with any questions you may have regarding a medical condition. Any application of the recommendations from this program is at the listener's discretion.